Hello everyone, I am Dr. Smitha, consultant endocrinologist. Today we are going to talk about PCOD in teenagers. So what is PCOD? Nowadays, a lot of people, a lot of women in the reproductive age, both in starting from teenage, which can go on to about 40 years of age, are getting affected with this condition called polycystic ovarian disease or polycystic ovarian syndrome, or PCOD in short. So what exactly is this condition? So this is basically a imbalance of hormones in the body, which leads to something called anovulation, or the ovaries not producing ova, and this can cause problems with irregular periods. So what are the different problems that can happen with PCOD? The most common complaints that the young girls with PCOD have are irregular periods, acne or pimples, and unwanted hair, especially on the hair, called hirsutism. So why worry about PCOD in teenagers? Usually after the first onset of periods, or what we call as menarche, these girls tend to have irregular periods anyway, but we need to worry about whether they have PCOD if they do not get periods for at least 3 months in a row in the first year after their onset of periods, or after 2 years of periods if they start having period cycles of less than 3 weeks or more than 1.5 months. Then they need to approach their doctor to get investigated for PCOD. And it is quite a common condition affecting at least 5 to 10% of the women in the reproductive age. So it can be quite common even in teenagers. So what are the major problems which the teenagers face because of PCOD? First and foremost, problems with irregular periods, which can worry both the patient as well as their parents. The second thing which they can have is very problematic acne. The problem with the diagnosis of PCOD in this age group is that usually they have period problems and acne anyway. But if they have very troublesome acne which is not responding to the regular treatments, and they have excessive unwanted hair on the face or any other parts of the body, then it is better to get help to see if they have a diagnosis of PCOD. Other problems they can have, which is the most worrying thing, is obesity. These young girls with PCOD are more prone for obesity. So how do we manage these young girls? So we initially, when these girls come to the doctors, we have to do certain tests to diagnose the PCOD condition. Ultrasound diagnosis may not be that helpful in this age group, but the blood tests certainly help, and so we advise them about certain blood tests, like especially if they have a problem of acne and unwanted hair, excess unwanted hair. Then we talk to them about serum testosterone levels or the male hormone levels, because PCOD is mainly a condition of excess male hormone in the body. So we do tests called testosterone level, serum testosterone level, LH, FSH, and certain other hormones. But the main other thing also to worry about is, because of the obesity, these girls can also be prone for other problems, although at a later age, such as pre-diabetes or type 2 diabetes. So how do we manage these young girls with PCOD? The first and foremost treatment for all girls with PCOD is to lose weight. Most of these girls are overweight or obese. So the first advice is to lose weight. Any amount of weight loss definitely helps with all symptoms of PCOD, including irregular periods, acne, and unwanted hair. So it is better to get a regular diet plan for weight loss, and also try to get a good exercise regime, at least 30 minutes of physical activity a day or 150 minutes of physical activity per week. Then with regards to which complaint is the most bothersome for these girls, then we decide other treatments, like if they have irregular periods, then we go for combined oral contraceptive pills which contain some hormones to regularize the periods. Or if they have acne, severe acne, we refer them to the dermatologist. And if they have problems like excess unwanted hair, then again we go for a combination of hormone pills and some anti-androgen treatments. Besides this, they can also go for hair removal treatments like laser treatment or other hair removal methods. So it is very important to get an early diagnosis of PCOD even in teenagers, because if we are able to diagnose this condition early and we are able to treat the complications or the problems that they have with PCOD, it can have a very good they can have a very good outcome and control all the symptoms that they have. Another problem that these young girls have are, because of their symptoms, they can have a lot of psychological burden, especially in the teenage, when they have other hormone disturbances, and the psychological issues can be quite problematic. So it's good to go to not only go for a wholesome medical treatment, to get good counseling. Psychological counseling at this age group also helps in the treatment of PCOD. So if you have any of these symptoms in the teenage girls of irregular periods, either getting 2 short cycles or long cycles more than 1.5 months, or 3 months without any cycles, with obesity, with severe acne and unwanted hair, then please do approach your doctor to get investigated for this condition of PCOD. Thank you.